My name is Dr. Cheryl Burdette, and I am the director of the clinical research or clinical component of Origins Incubator. And one of the things that we do is we have classes every week where we discuss cases, but also available is the opportunity to do a one-on-one and discuss your particular case with the faculty in terms of things that we might consider. And so an interesting case this week that I got to discuss with one of my colleagues was a 42-year-old male, and he was noticing an increase in anxiety and irritable bowel syndrome since he had experienced COVID. And so he had a past history of more sleep apnea, fatty liver, even glaucoma. And so we thought about what direction to take him in. And a clue is if especially at this age group, one of the things that can both trigger anxiety and irritable bowel syndrome, and especially an increase in pain with IBS, is a declining testosterone. And so andropause, the decline of hormones in men, tends to not be as overt and dramatic as it is in women, because in women we go from having fairly high levels to a drop off kind of more all at once. So some, of course, gradual decline with age, but more a bigger drop as cycling stops. With men, it's just a slow drop over time. There's not a big drop off, so again, it's not always as apparent when these things are occurring. But one thing to watch for as testosterone declines is for our male patients to experience more anxiety and panic attacks from this. Testosterone is one of those things that's known to give us courage and keep us sharp, and so that decline can manifest as feeling more anxious in our men, and we will have more IBS, more pain with IBS in an environment where testosterone is low. In fact, testosterone has been given for IBS and shown to have positive outcomes. So in this case, we talked about what we could do naturally to increase testosterone, when we might use more of a prescribed testosterone. What are some of the best ways to look at that in terms of testing, but really honing in on why was he experiencing both the IBS and the anxiety, and especially post-COVID. What we also know is that one of the subsets of people with long COVID have been shown that their hormones suffered because of it. So when there was an increased production in cytokines and inflammation, this can send a signal to the body that says we're too inflammatory right now, don't procreate. But it's a stress on the system, and stress, evolutionarily speaking, was there's not food to hunt and gather, so now is not the time to procreate. Well, infectious disease is also a stress on the system, and it will manifest in many of these same pathways saying, hey, you've just been through a lot, now it's not the time to procreate, so let's knock the testosterone level down. So it makes sense. A consequence of the infection would be that this could set into action this lower level of testosterone, causing the patient to feel more anxious, causing more irritable bowel syndrome to manifest itself, and putting us in a clear direction in terms of what steps to take next in order to treat root cause of what's going on in terms of chief complaints in his system.